Great. Well, thank you so much for giving a warm welcome to each other. Thank you so much for logging in this morning. I'm all welcoming you all to California Bridge Connect's virtual kickoff. Thank you so much for joining. We have such great content for you today with our guest speakers, Katie, our navigator, who's going to be sharing stories. We just have a lot in store for you today. So I'm going to go ahead and jump in and let's get this started. I'm one of your co-hosts, Cheryl and Batac. I am Mat Expansion Project Manager with the Bridge Center. Some of you might have already chatted with me in the past, but really I'm supporting the team in coordinating in-person and virtual events, just like this one, and also expanding our Rapid Mat network. And we'll go into a little more about what that is in a bit. And the biggest, most important thing you should know about me is that I have a pug and a cat, and I love them. That's the most important fact you should know about me. I'll go ahead and introduce our other co-host, Arianna Campbell, who's one of our founders and principal investigators at California Bridge. Arianna is an emergency department and addiction medicine PA with over 25 years of experience, and she does work clinically at the VA Medical Center in Sacramento and also leads addiction programming at Marshall Medical Center in Placerville. Also, she does so much. So lucky to have her. I'm going to introduce Arianna and actually hand it over to her for this first section.
Thanks. I should also add that I have a big drooly bloodhound and four kids. All right. Well, yeah, no, I'm really excited to see everybody here. Thanks for the love there. I get to talk about what we've been doing, what we've been up to, and I think a lot of you have heard about it, but we're going to dig in a little deeper to it today because we're really excited that the work that we've been doing over the last gosh, it's been 9 years now, seven, 8, 9 years now, has expanded, and we're always keeping our eye on what people and communities need. So, as many of you know, since 2018, we really were thoughtful in what we thought people really could, how to engage people into treatment, what we'd want for our friends and family to engage in treatment. So we onboarded, trained, supported more than 500 navigators, medical providers all over California into, treating opioid use disorder, alcohol use disorder, use disorders with evidence-based treatment and how to engage people and get people into kind of treatment we'd want for our family or friends. We supported 290 hospitals when people said, hospitals don't want to do this. We really worked hard so that hospitals, it's like you can't not do this. This is something that works for our patients and works also for what we're doing in our emergency departments. Once you see it, you can't not see it anymore. And then we built a statewide network of navigators, providers, champions. We have as evidence, all of you here, so that people can get real treatment, the kind of treatment we'd want. For anybody to have access to. Next slide. And now, moments of humility, we tried to see, do people know about it? How do people get to care? I think a lot of people who are deep in this work get texts, phone calls from family and friends. How does this person get into treatment? I've been doing that for a number of years. And so we really put a lot of thought into what kind of access do we want? Sometimes I'm calling people on Fridays, like, who's the navigator in this place? How can we bring this huge network together so that people can very easily access it, so it's visible? And so we came up with this helpline, this like lifeline, right, for same day medication for addiction treatment. And this is backed by this massive network of substance use navigators provides, is informed by, we're connected to, and we're really trying to bring this all together to have the biggest network of its kind, where it's easy for people to see in communities, where people can share out, this number, and people can easily access it. And it's kind of like, I know my partner Andrew Herring says, it's kind of like the emergency department in the sky. We really want people to have quick access to the treatment that works for people. And so we can help anybody struggling with opioids like fentanyl. We're getting this out there so that it's easy to get life-saving care. Next slide. And we know, it's funny when you take a look at, yes, we create this massive network, but there's still, nearly 90% of people living with opioid use disorder don't have access to medications for addiction treatment. So many feel isolated, judged, right? I always say, Well, if you had high blood pressure, people say medications, work for this. We need there to be these norms where we're all speaking the same language and people know that it's good to access treatment, that it's easy to access treatment. And we need this, we all need to be singing the same tune, right? So that we can decrease stigma, misinformation. And then we need everybody on board. This is an all hands on deck moment, and we need to connect these fragmented systems, and we also need to eliminate all these long wait times and things that discourage people from getting into treatment. Next slide. And so this is a solution. This is something that we've been really thinking about for a number of years, actually, as kind of the missing piece. And, I've often said when I did a secret shopper, I realized the thing that is visible to people when they're seeking treatment is not the thing that I'd want them necessarily to think is the standard of care, right? We know that people need medications for opioid use disorder, that's first and foremost, that's protection for people. They need access to naloxone. Often they need, there's so many parts of this puzzle that people need access to, but we want to make it really easy. So we're trying to bridge that gap between where people say, I need help, and make it like right there, front and center, and connecting all Californians to then local providers. We want to make sure that people can connect locally. And I often say like our county system, people sometimes have trouble figuring it out. They don't know that this county, you have this insurance, you can't access services in this county. That's where our navigators come in, is really helping just like pave this pathway so that somebody seeking treatment can contact this Connect hotline, and they can text or they can call. They can speak with a navigator. So Katie's going to follow me here, and you'll meet Katie. But we also even hired two more navigators, so we have three navigators now working on this line so that we can figure out, first of all, what does the person want or need? And then we can really connect them to on the ground treatment providers who can help. And we want to do this really quickly. So I will say we have moved this into that crisis system of care, like recognizing the number one cause of death under the age of 45 in California is overdoses. So we need to address this with the same, like with this crisis type of urgency, and so that we can connect people to care very quickly, capture that moment, get people to buprenorphine, methadone, overdose prevention, that could be naloxone, peer support. So we want to see what people need or want, and then make sure we connect them very, very quickly so it's not frustrating, and then stay connected. So it's an open door, right? This is a community. This is a community of people coming together, providing rapid access to care. And then we want to stay connected with people so that they have an easy lifeline to call should they need it. So next slide. So why navigators? I mean, like it's like the bread and butter. It's navigators. They've been trained by Bridge, a lot of experience in getting people into treatment. In fact, at my own hospital, double the likelihood that somebody gets medications for addiction treatment. Navigators, they understand addiction, the barriers to treatment, focus on building relationships, and that's it. It's like it's not just we're here. It's actually engaging. It's really trying to bring people into treatment so they know that it's safe, that their needs are going to be addressed. And it's really this relationship building, to build trust in the community and to guide people through care. And so the whole idea and what Katie's been doing is, this one, sometimes people, and she'll tell some stories, but people can call and be kind of timid. I'm not sure what this is, I'm not sure what to do, but it can really, our navigators are really trained in how to take this one phone call and make it into a path forward. Next slide. So there's a lot of hotlines out there, and we're learning more and more. And if you have a hotline, if you have something where you're doing this, please let us know about it. We want to increase the visibility. We want to bring people in. So what sets us apart is that we're statewide, right? Anyone can contact the helpline. So again, there's people who might be in one county, but their insurance is another. So people need support. There's youth justice involved, pregnant, postpartum. A lot, people have their own unique challenges. And in terms of getting care, there could be friends or family who are just kind of curious, like, what should we do? So we have navigators, we have clinicians who are kind of curious, social services providers. We've had street teams who can call. We've had mental health providers who call and say, hey, how can I get my patient or this person connected to treatment? We've had overdose prevention specialists beyond who call this line and say, how can I get this this person into treatment. And it's not always obvious, right? So we're there to help. And we went active statewide. Why? Because day one we started in one county in El Dorado County, and day one we people found us, right? People were really looking for care, and so we were getting calls from all over the state. People who have insurance in one county but are now in a different county and have run out of their buprenorphine and they need to know how they can get it today. What pharmacy can I go to? How can I get a prescriber? People who are experiencing homelessness, other factors that create barriers to care. So, I say it's the AAA insurance kind of for people with opioid use disorder or other use disorders because, you may have your mechanic, you may have somebody who's prescribing you buprenorphine in one place. You may have like a team of people who are helping you with certain things. But when you get stuck on the side of the road, you may need help. And that's what CA Bridge Connect is there for. So we're really looking to identify the needs in different areas, challenges of our patients, and we want to erase those for our patients and get people to care. And the support is community based. So again, there's so many options for substance use care, and we're really trying to be the visible central line to bring people in, so people know that this is available, and navigators can connect people to treatment. So we're relying on this network of navigators to really bring people into care and be visible, so that people know who to call and where to go. Next slide. So how are we doing this? How are we reaching communities? So we've been doing a lot of outreach, but we want to hear from all of you. So we're calling, this is our SUD crisis response network, right? So we have navigators, we have clinicians. You're all a part of this network now. We're this crisis response network for substance use disorder. So we are working, there's street medicine teams, social service sites. We're going to various counties, different areas, and we're just putting promotional materials all over in California communities. And we're collaborating with a lot of existing crisis systems, including, so we have an example, which we can talk about, 988 Lifeline just in Alameda County, where we're connected to that 988 Lifeline to really make one spot visible. So if people call 988, they get some information on how they can connect to care for opioid use disorder. And we're looking to do this all over California. So we're also connecting to county access lines, and it's bi-directional. So somebody needs buprenorphine now, we're here. We're the place you can call. If somebody needs to find residential treatment in a certain county, we can help connect to the county access line. So it really is bi-directional, and we're there to connect care across California. Next slide. And so far, we have so many stories, and Katie has so many stories where this has been life-changing for people. I can tell you when we were doing some work in El Dorado County, just seeing the gaps. Like we have a great system of care in our emergency department. We have heroic clinics, people out in the community doing a lot of work. And there's still a lot of people who have no idea it existed. So when we go out there, we launched in April 2026. And just in the last 3 months, we've just like sort of launched in 4 counties. But then again, went statewide because we were already getting calls statewide. So we just said, hey, let's be available for everybody. So everybody here should have this number. Everybody here should be asking for the materials to get out in your community. And so far, we've had 415 total calls. We've had calls from 26 counties, we've had somebody from almost half the counties in California already call, even though we only officially initially went out to 4 counties. So this is very, very needed. We've had 91 referrals by CA Bridge Connect Navigator to addiction treatment and other resources. So we've been able to connect people to care, and 105 referrals just from Alameda County's 988 crisis line. So we know there's a great opportunity to connect to all these 988 crisis lines, to be extremely visible, and then to bring people into care. And that's how we can get through this. That's how we can decrease overdose deaths. That's how we can protect our family, friends, and our communities. I'm going to turn it back over to Cheryl Ann for this next part.
Thank you so much, Ariana. And I am seeing a few questions in the chat already. We're going to have a Q&A section after our panelists speak. So I'm going to save those questions for in just a little bit, but we'll make sure to come back to you. Alice and also Sarah, we'll come back to your questions. We just have a lot more content, and I'm really excited to introduce our panelists today. Katie Quijada is the navigator, one of the navigators behind the CA Bridge Connect service. She joins California Bridge with 7 years of frontline experience working with people who use drugs and harm reduction programs, street medicine outreach, and emergency departments across California. We're also joined with Dr. Reb Close, who attended medical school at UCLA, after which she completed residency in emergency medicine at the UCLA Olive View program in Los Angeles. She practiced emergency medicine for 20 years and transitioned to addiction medicine between 2022 and 2024, and currently practices addiction medicine and seeing patients in outpatient practice as well as in street-based and jail settings. Let's give them a warm welcome. They're both going to be, sharing about California Bridge Connect. What does this look like in practice? Katie can help give stories to individuals with diverse backgrounds and how people have been connected to care. And also Reb will be sharing a more county landscape perspective, exploring how CA Bridge Connect is being and how it could be integrated and why it's so valuable. And to share these anecdotes, let's give both of them a warm welcome, and I'll pass it over to Katie, who will kick us off.
Thank you so much, Cheryl. Hi, everybody. I recognize so many familiar faces and names in here. I'm so glad that you're able to make it today. I'm Katie. I'm the Senior California Bridge Connect Navigator. I work with a team of two other navigators on the line, and I wanted to share two stories from the line that kind of showcase exactly what a navigator does when somebody calls into the line. I want to tell you guys about their story and kind of show what happens. The first story that I have is about a young man who was recently released from incarceration. He was seeking a faster pathway into detox for fentanyl use. He had already called his county access line, and he was already on a referral list and a wait list to get into detox at the first available bed. But he also was going through withdrawal every time he stopped using, and that was keeping him from being able to make it to detox. Like he couldn't tolerate the withdrawal symptoms while he was waiting to get into detox. So he called a crisis line, and the crisis line referred him to us. And he called in asking if we could expedite his detox referral. Unfortunately, because we don't work for the county and that's just not part of what we do, we couldn't do anything to help with the detox placement because his county had an exclusive referral pathway with Medi-Cal. But he told me over the phone, like he said, he couldn't tolerate the withdrawal symptoms while waiting for detox. So I told him about buprenorphine. He had never heard of it before. He didn't know what it was. And I said, I could get you an outpatient appointment today to start medication so that way your withdrawal symptoms will go away and you'll be able to hold yourself together a little better before you get into detox. He gladly accepted my offer, and I was able to get him a same-day appointment with a MAT provider at a local clinic, and he was really interested. But we learned that the clinic was in the same neighborhood that he had been shot in the past, and he wasn't comfortable going to that neighborhood anymore. So I said, okay, let's explore some other options. And I found a clinic that he would just have to fill out an online form to get seen through telehealth and get a prescription sent to him. I sent him the form. I checked in with him maybe an hour later, and he said, hey, this form is really confusing and I don't know how to fill it out. And I'd prefer if I could just, I don't want to do this. And I said, okay, well, if this is a barrier for you, then let's figure something out. And I called my third resource in the county, kind of pulled the final clinic out of my hat and asked them. I said, hey, this is my guy's situation. And they said, yeah, we do open hours from 2 p.m. to 6 p.m. He can come by anytime in those hours. And I told him so. And he said, oh, but I can't get a ride to the light rail station to get there. And I said, okay, let's figure this out. And I called back the MAT clinic that I was referring him to, and I explained his situation. I said, do you have any transportation support? Is there any way I could get a lift to your clinic? Is there something we can do? And they said, actually, yeah, we'll see him through telehealth too. He can do his labs and his blood work at the closest labs, and his pharmacy could be right walking down the street from his house, but we'll see him through telehealth. And the next day, I was able to facilitate that warm handoff, and he had an appointment for 2 o'clock through telehealth. And I tell this story because even in areas that have multiple low barrier options, a navigator is sometimes needed to really facilitate that warm handoff and make sure that the community members get into care that works for their circumstances. He called not even knowing what buprenorphine was, much less what options he had to start at ASAP. And even though he called looking for detox, what he was really looking for was relief from his withdrawal symptoms, and we were able to provide that for him. But it took a village, like it took an entire network of people in his county to be able to get him to a resource, which again showcases just how important it is that we have people on the ground who are able to receive people who call our line. The second story I want to share is a mom who called into the 988 system in Alameda County. She called in looking for mental health support for her daughter who used fentanyl, and she was referred to our line. And when I called her back and, explained what we do, she actually said, "Oh, I'm also on buprenorphine for kratom use. And I've been paying a private telehealth provider over $100 per month to get my buprenorphine." She also explained her situation to me. She is living out of her broken down car on the streets of LA, hundreds of miles from her home county. And she was unable to afford a mechanic to fix her car so she could get back home. And at the same time, she's paying over $100 a month to a private telehealth provider to get her medication that she needs. So when she shared that with me, I said, let's figure something out. At that point, her daughter had been incarcerated, so there was not much I could do for her, but I could at least help the mom out. And I said I could get you a provider that would accept your insurance, so that way you wouldn't have to spend that $100 every month, and hopefully that money could be going towards, your basic living needs or the mechanic that you need to get your car fixed. Here's where the challenge came. She was in Los Angeles and her health insurance was in Northern California. And I needed to find her a local provider who would do telehealth for her. And I also needed to find her a pharmacy walking distance or public transportation distance in Los Angeles that would accept a buprenorphine prescription from an out of county place, from arguably like 6 hours away. So pharmacies are a notable barrier in receiving care because of stigma towards people who use drugs, concerns over buprenorphine being an opioid and a scheduled substance, even though it is a very safe medication to take, and general reluctance to provide addiction medicine treatment in a pharmacy space. And like I said, all of that, and it had to be within like a 1 mile radius of where her car was broken down. So it shows again, if this woman was trying to embark on this journey by herself, I don't think she would have been able to do it, honestly. I think she would have had to stay with her telehealth provider that she was paying good money for, because California folks are facing this struggle daily to try to get addiction treatment, and the people who need the most help have the biggest barriers to receiving care. So I was able to find a pharmacy. I had to call, I think, like 10 pharmacies and ask them, hey, do you carry buprenorphine? Would you be okay accepting a prescription for someone who lives locally, who's getting a telehealth provider to give them a prescription? And it ended up being this little mom and pop pharmacy in downtown LA. And shout out to our little local pharmacies because they are our allies in this. They've always been our allies, and I'm so grateful that they exist and that they're here to help us. But I was able to get her a telehealth provider and get the pharmacy to give her her prescription. And like I said, I really don't think she would have been able to do that without the help that we were able to give her. And without having the network of folks that we have available to be able to get her the help that she needed. So California Bridge Connect, we exist to serve as like a catch-all, as a safety net for the folks who can't just walk into their nearest clinic for care, who might need extra support in accessing MAT, who otherwise would be kind of left, what's the saying, in a boat without a paddle or something, unable to do what they need to do, unfortunately. But yeah, those are my stories. Do you want to pass it off to Reb, Sherilyn?
Yes. Oh, so I will go ahead. Thank you so much, Kate, for sharing those great stories, anecdotes from the line. I would like to go ahead and pass it over to Rev, who will now share her side as a clinician who's receiving some of these referrals.
Yeah, and does anybody else think that Katie needs like a Swiss Army knife kind of thing on her background? Like that woman's amazing. I just, oh my gosh, Katie, you inspire me. So thank you so much. Yeah, so as was mentioned in the intro, I work in our brick and mortar clinic. I work in street medicine. I do inreach into the jail and juvenile hall. So I'm one of the recipients of calls. Can we get somebody connected? But in addition, I also use this service to connect people moving forward that maybe aren't in my area or they need something that my team is not able to best provide. So I kind of have both hats here. I also work with our EMS teams. We do EMS buprenorphine here in our Tri-County region. We pulled this together. Actually, we were the second group to go live, and we pulled it together as a Tri-County collaborative. So Santa Cruz, San Benito, and Monterey, we launched together because we share patients. Just we share providers. Patients will have their Medi-Cal in San Benito, but they're down in Monterey taking care of a family member or whatever's happening. And so we need this connection even within our own tight network that works together. And so I just wanted to bring that perspective. Is we as providers, all we had to do in our clinic is have a few hours for open time. Like exactly as it was said, we take walk-ins or call-ins from 2 to 6 or whatever the time is. Each day we just talk to our docs, like, would you be available for urgent visits? And the answer was a resounding yes. And so that's all we had to do to make sure that we were able to bring some connection to care for these patients and be available. And so we've been able to do that. But when I get asked, even by somebody in our Tri-County region, how do we get so-and-so, or, how do I get a patient connected to care? I literally flip around my laptop and pull up the bridge number. I don't know if you can see it. It's with all my other little sticky things. I guess you can't with oh, there you go for a second. But I literally close my laptop or flip it around and say, okay, so call this number or text this number, because that's how you can get somebody connected to whatever services are going to work best for them. And then now, in listening to Katie, you realize that our Swiss Army knife will just whip out whatever tool is needed and get that person connected to care and to treatment. So I think that's the most important thing for my sharing in here. And I'd love to answer questions, but we all have a role within this system, and just remembering that this service is available and then connecting with how you can contribute to this work with what your teams are doing. I think that's really important. It's our whole system kind of working together to maneuver patients towards their needs and their goals. And one of my kind of favorite quotes is, I don't know the answer, but I know who does. And that gets back to what Katie is amazingly able to offer across the lines. So whether it's your EMS teams, making sure they have the flyers and the stickers and all of that. So just like me looking at my laptop, they can look at okay, here's the number to call. Let me give you this flyer to your family member. Keep this with you in case you want, any information in the future. So doing that with our AMS teams. For our jail and juvenile hall, we have the flyers with the little pull-off phone number tabs at the bottom. And we just have those posted, and we just keep replacing them as people tear those off. So having it that low barrier, a family member doesn't even have to ask a question. They can just pull off the tab and go, or grab one of the flyers and go. It's really trying to make that easy, whether it's in your juvenile justice or your adult carceral setting situations. Sticking this information on your Narcan boxes, literally just anything and anywhere. Let's get this information out so people can connect with our Swiss Army knife and our team and move forward in this care. So I would love to answer questions and see what we can figure out, because this is also part of it, is this community learning from each other, maybe what we're missing, what we haven't thought of, and how we can better connect.
Thank you so much, Reb, for sharing your. I'm gonna go ahead and share my screen again, but thank you so much for sharing your perspective as a clinician who's receiving referrals, who's also doing the work to spread the word in your county about this resource. So now we're gonna go into our Q&A section. I want to go bring it back to the first couple of questions. And I see one actually from Alice, and this Q&A section, it could be for Katie, could be for Reb. Also, me and Arianna are here to answer some of these questions as well. So Alice asked a question: what credentials do your ED navigators or our California Bridge Connect navigators hold? Katie, would you like to speak on that?
Yeah. Me, Emma, and Philip are the three navigators at CA Bridge Connect. I have my CHW, my community health worker credential, and I believe Philip does too, and Emma's working on hers. We're all going to be CHW credentialed. Um, in addition to that, all of us have experience working with people who use drugs in medical settings. We are familiar with the community, we're familiar with MAT and the needs that folks have. So a lot of what we do comes from the experiences that we've had before working in this field. But as far as credentials, as far as, sticking something at the end of our name, we're all going to be CHW certified.
Thank you so much, Katie. And Alice, let us know if you have any follow-up questions, and feel free to email maybe me, and I can help get you connected if you want to learn more directly from Katie, Emma, or Philip. I'll go ahead and ask a question from Sarah. Sarah had asked, like, she has a clinic. How do we make sure that we're on the list in the network of places to receive patients? And I actually can touch base on this one. We're actively doing outreach to clinics, and we want to, especially those who have MAP programs, who can receive patients, who has a MAP program. We're actively doing outreach, and we want to learn more. We want to talk to you. So if we haven't contacted you yet, it's not that we don't want to, it's just we haven't yet, and we do want to be connected. So I'd love to speak with you. Sarah did share information. She did have to hop off, but I will be following up with her for One Community Health in Sacramento, actually one of the places that was on our list to be connected. But if there are any other clinics here who are attending today, and you want to be a part of our network, and you already are in our network because you've attended this kickoff, we will make sure that we follow up with you. We want to be connected. We want to learn more. Let's set up a call and talk. And so if you want to put your information in the chat, you're welcome to do so. And we'll also give in a few more slides an email that you can go ahead and send as well to just let us know that you're interested in having a one-on-one and for us to chat about how you can be a part of our network to receive some referrals. Okay, let me go down to the rest of these questions. I have a question from Kayla. Do you work with virtual providers who support MAT and have PHP IOP levels of care? And so I will pass this question over to either Arianna or Reb.
Can you repeat the question?
Yes, it is. Do you work with virtual providers who support MAT and have PHP IOP levels of care?
Oh, and PHP. Actually, Katie, in terms of our network with PHPs and IPs, so we are doing all of this groundwork to find all of these low barrier clinics that are offering medication. So I will say that first and foremost, we connect people, we make sure people get to medications really quickly in that crisis manner. That we have a lot of great PHPs and IOPs out there. But Katie, can you comment on that a little bit in terms of what we found in communities?
Yeah. If anybody expresses interest in PHP or IOP, then I am 100% open to connecting them to that care. The main focus of the line is MAT, and like Ariana said, like getting folks out of crisis and into a place where they're able to continue care and like being their best selves and everything. But if that involves IOP and PHP, we're open to it. I wouldn't say no. I wouldn't tell them, "Oh, we can't do that." I'm going to do whatever I can to get them into care.
Thanks, Katie. And then I know, Reb, you also have telehealth. And so I'd love to hear a little bit more about that and how we're working with your clinic. Also, that kind of goes along with the question about working with virtual providers.
Yeah, definitely. So we do a lot of telehealth, very low barrier. In fact, when Katie mentioned there was a form, I'm like, form? Why is there a form? Right? So we will receive calls or texts, and we will follow up with those, give the person a call. We try to do video when we can. If not, we don't. And literally the prescription goes in that moment. This is where, though, Katie's research and what she had to do for the pharmacy part of it is really amazing. I dealt with this yesterday for one of my very well established patients who went into prison, just got out of prison. His cures report shows nothing because a lot of the carceral setting prescriptions don't show up in cures. And he was still out of area because of probation issues. But he's my patient, has been for 3 or 4 years. And so I was trying to figure out exactly what Katie dealt with the pharmacy, because here I am in Monterey. He was in, Fresno or Modesto or somewhere. I can't remember where I had to send that. And he had nothing on his cures to say that I was his or that he was on this medication routinely. So those types of barriers are what I face with telehealth. I totally saw him in telehealth yesterday because he's still out of area. So it's really nuanced. So I think breaking down any barrier that you can to telehealth within your own system is yes, please. Because in that circumstance, I mean, we all know it is way easier to get fentanyl than buprenorphine in the vast majority of patients' lives. So we've got to take down that barrier. So yeah, I love the question about telehealth and how we can make it easier. The federal guidelines that came down in January, my team is still pulling information on how to best interpret them. So if anybody has that all lined out, please share. But I think we're all doing the best we can to get people connected and moving forward.
Thanks so much, Reb. That was really informative. And again, another way, and just shows how CA Bridge Connect, we have different ways, but we really bottom line is we want to get people connected to care quickly. We are moving on to the next question. Do you offer virtual presentations to community meetings? And actually, Sarah put it in the chat. Yes, we do. And so if you want to contact us, request a one-on-one orientation, or if you want us to provide a similar presentation or shorter version at one of your community meetings, we have done this before at coalition meetings. We've attended and done orientations with community-based organizations. And so we're definitely welcome or open to that. And if you are interested and wanting to invite us to chat at one of these community meetings, you can go ahead and click that link that Sarah shared in the chat, cabridgeconnect.org/contact. I'm seeing a couple of comments here about how you'd like to get connected. We're going to make sure that we have your contact information. Thank you so much. I have a question here that both Katie and Arianna can speak to, and also Reb as well with San Benito. But how are you all working with rural counties?
That's actually where we started. So I live and work in rural, in El Dorado County, which is a rural county, and I know Reb is doing that. That was kind of a, even Bridge, when we founded Bridge, we always have had an imprint on rural counties. So, it really is a resource. I will say in our rural county here in El Dorado County, there was people who were trying to stand up various lines, one for like for our maternal, SUD related issues. One, there was various things that people were looking to stand up. So what was really nice is this is something that's visible. And I think rural counties in particular, with like the county to county, people move. Sometimes people live along county lines. It's really confusing, like how to get care in some of these areas. And then even to connect to, to connect to telemedicine or these local clinics. It can be confusing. So I will say we've always had like rural counties have been really central in this work. So yeah, Reb, I don't know if you wanted to add anything there, if there's any specific county information about counties, but like the very first county that we implemented in is a rural county. So Um, Hopefully that's helpful.
Yeah, and I think the telehealth is a big assistance there. So what we did for San Benito is one of our docs just loves going up there and seeing patients, but he's only able to go a couple days a month. And so what we did instead is really just kind of embraced it. We're all the same. So, the vast majority of the patients that are being seen for San Benito County are affiliated with our clinic. So we'll just do it with telehealth. If somebody pops up and does an in-person, that's great. If not, like we bring it to them in whatever capacity we can. And that was a big reason when Francesca and I were talking about CA Bridge Connect, or was it 6 months? No, gosh, I mean, 7, 8 months ago. That was a big part of why we went together as a trio, Monterey, Santa Cruz, San Benito, is so we could pull in everybody in our region. And telehealth makes that possible. And so, if someone has a prescription from 4 of my docs, because a couple of them are telehealth, and then somebody goes, great, we're all on the same team. Look us up online. You can see we're all together. It's not, the patient's not doctor shopping, other people are faking. Sorry, I can laugh about that in this group because you know exactly what I'm dealing with. But yeah, so that's how we did it, is we just all moved forward as kind of en masse.
Thank you both. I'm going to move us on to 2 questions that seem pretty related. Are you working with assertive field-based treatment? I believe that's referring to the county BHSA, and also a question about funding for this. And so maybe Arianna can talk about funding, or actually, Ron, would you be able to clarify your question if the question for funding, is it more so, is there funding for us to provide the line, or is the line free? But I will say the line is free to call in. And then the services and the referrals that we're making out to the clinics, we're hoping and that they're free or low cost, and really prioritizing that. Really, we're focusing on low barrier. And so if that helps with the question, but if you have any clarifications for that, let me know. But
Is
yeah.
it funding? Are they asking about funding for Bridge? We're funded from the Department of Healthcare Services from State Opioid Response, but is that the question?
I actually am not sure,
Okay.
but if you want to go ahead, Ron, and just let us know what your question is via email, we're happy to answer that as well once we have a little more clarification. But Melissa, on assertive field-based treatment, we have spoken to counties. We did learn about Behavioral Health Services Act, and California Bridge Connect does have pieces and aspects of it that does fulfill the requirements for assertive field-based treatment. And so again, we can talk more about that if you'd like to email and learn more. I'm looking at a few more questions. We do have a few more minutes together. Oh, Judy would just want to know more about California Bridge. What does this organization do? And so what is California Bridge? Arianna, do you want to share?
Yeah, we're mission driven, grant funded nonprofit, and we are obsessed with helping people get care to decrease overdose deaths. So we've been really laser focused on that for since the beginning. And so we started out in California by recognizing the importance of emergency departments and in being an open door to care and to really connecting people with life-saving treatment. So we worked really hard to elevate emergency departments as a friendly place to initiate people on medications for opioid use disorder, and we trained and really facilitated the integration of substance use navigators into emergency departments. And then we've been building on and training all of our clinicians out there on how to do this both in the emergency departments, hospitals, EMS, low barrier clinics, and then we have been working very hard to innovate an entire system of care to meet the urgency of the moment when somebody is asking for help for a substance use disorder, to really recognize that as a moment in time that we need to meet it as a healthcare system in the same urgent fashion that we'd want for our family and friends. And then we've moved that work across the country, and we have worked in hospitals across the country to do the same. And we just keep on trucking. We're obsessed with this. So this is why we developed CA Bridge Connect, is because we saw this gap that we really wanted to make sure that we filled with, again, the kind of texts and emails and phone calls we were getting for people really desperate to find care, and we wanted to match that with a resource that people that is visible and easily accessible. Hopefully, I covered it. What did I miss?
No, that was great. And again, we're happy to talk more, let you know. I do see, Judy, that you're a nonprofit who wants to have a connection with organizations that can help with people who are experiencing homelessness. We'd love to talk to you and learn more. So, Judy, we will be reaching out, or you can go ahead and reach out to us as well once we share that email at the end of this presentation. I see one comment that I would love for Katie to speak on, just in general, to talk about the populations that might be calling in, especially there's a question about youth and what that might look like, and maybe other potential populations who may be calling in, like pregnant postpartum. What does that look like, and how can we serve those populations as well? And then after that, we'll go ahead and continue with our slides. That will be our last question.
All right, yeah. So part of what we do when we're vetting our resources and making sure that the folks that we're referring out, or the clinics that we're referring out to, I always ask them, do you serve youth? Do you serve pregnant people? Amongst the other questions that I ask them, those are really important questions for me to know, because I haven't gotten a youth that has called in yet, but I have gotten a few pregnant folks. And each county is different. Some of them prefer to be sent to the ED. Some of them will see them outpatient. Others want to admit them for detox in the hospital. Like, it's really regionally and county dependent on what kind of care those populations are going to get. So those are questions that I'm thoroughly asking when I'm vetting our clinics to see who they can take. So that being said, we've helped out a few pregnant folks. We have a list of providers who will see youth. I understand that, they will only see youth like 16 and older because of like different laws about substance use treatment and consent and everything. But we have the availability, we have the options for them.
Thank you, Katie. And I will go ahead and close out our Q&A. And also the word Shelley had just put it in the chat, and I don't have any better words to say this, but really the heart behind all of this is we want to meet people where they're at, get them feeling well and on their way to recovery, and also just making sure we follow up in their journey. We won't leave them. We'll follow up with them throughout, and that's really what CA Bridge Connect is all about. And we have a couple of next steps for you all. We would love for you all to stay engaged. And so we understand that transforming addiction care takes community-wide leadership, right? We are envisioning a network that just values lived experience. It values community knowledge alongside clinical expertise. And everyone has a role here. Everyone has a role to take action, help expand this network, to make sure folks are connected to the care that they need when they need it. And so I have here the network, the potential different players, some examples: people seeking addiction support, their friends and family, navigators, clinicians, community health workers. EMS is a huge part of this, street medicine teams, youth services, social workers, hospitals, justice involved communities, overdose prevention services, harm reduction services, peer support, county health leads, community leaders. Everyone belongs in one of these categories, or if you're not in this, you are also in that category. We just didn't have space on the slide. And so please stay engaged with us. You are the network. You are basically what makes this happen. And so thank you so much for joining us today, because we couldn't do this without you. And we will not stop emphasizing that point. Some call to actions. What you can do today is you can order promotional materials for free. Reb was actually showing them during her story, she had some flyers. So if you want in-person materials to put either in your clinics or in your offices, or even to have on hand just in your cars, just if you feel like someone might need help or maybe a family member, you can order them for free. So if you can go to the Spread the Word page, which will be linked in the chat. You can go ahead and order materials on that form, and you can also access our digital materials as well for you to share out the flyers through email, in your distribution lists, in your newsletters, etc. You can help us spread the word about CA Bridge Connect. And call or text CA Bridge Connect. Call into our line, text into the line. If you want to learn more about the helpline, if you want to speak to Emma, Katie, or Philip, or if you want to connect someone to care, it is free and confidential. The call number is 1-800-944-1807, and our text line is 1-833-308-0461. There are other ways to stay engaged as well. You can submit a referral. And so this link will be in the chat as well. And you can complete that form to submit a referral. And so really it's designed for someone to refer a friend, a family member, a patient, a client, anyone really. You can also use the form to request support for yourself. And really, it's intended for providers or allies just like you, organizations who are on this call right now, to connect people to care. So when someone fills out the referral form, it will go straight to Emma, Philip, or Katie to evaluate and then also follow up on. And so this is an option if someone doesn't want to call or text. It's just another open door for folks to get connected, an easy way to make sure people are connected to what they need. You can join our MAT expansion network. We can send callers to you, right? We talked about the one-on-one. If you want to be up to date with the latest best practices in low barrier care, you can fill out our contact form. And so that will be linked. You can also request a CA Bridge Connect one-on-one orientation. I mentioned, and there was a question about if we do meetings at community meetings or coalitions, etc. Yes, we definitely do so. Fill out our contact form as well, and we'll get back to you. Saw a couple of comments in the chat like, we want to be connected. Yes, we'll go ahead and make sure we're connected. Fill out that contact form, and we'll get back to you. So these are some ways to stay engaged. And I would like to now go into a poll before we end, because we just love to hear from you about, in your community context. I'll actually just share the questions first because these are things we want to know, and then I'll start the poll. So the two questions we want to ask you is, in your community/context, which populations need greater access to substance use support? These answers will really help inform future webinar focus areas. We have this virtual kickoff, but we do want to continue providing more webinars and want to learn from you what topics you'd like to hear from the most. And also, number two, what information would you like to regularly receive from CA Bridge Connect, and check all that apply. If you want to learn more about the data on CA Bridge Connect, more stories and insights, or tools and resources, as well as other updates, we want to know what you want to hear from us in the future. So I will go ahead and let Aiden start that poll, and we'd love to hear from you on these two questions. So we'll start off with that first question again. In your community/context, which populations need greater access to substance use support? Check all that apply. It should pop up. And we'll give it about a minute here for you to answer. And there's youth, there's re-entry populations, there's pregnant postpartum people, unhoused communities, and other. Feel free to write it in the chat. So I'll give it about 30 more seconds here. Thanks for filling out that poll, everyone. Just a couple more seconds. Thank you so much for your input and your feedback. This is going to be incredibly helpful to inform our future webinar focus areas, and also maybe even some of the materials that we send out to you, like a newsletter, or if you're part of our distribution list, this will be really helpful. Okay, let's move on to the next question, Aiden. What information would you like to? Oh, I actually have the results. Okay, a lot of youth, re-entry, pregnant, postpartum, unhoused. It seems like we want information on all these populations. Looking forward to hosting more webinars where we can go dive deeper into how we're supporting these populations. Okay, let's go to the next question. What information would you like to regularly receive from CA Bridge Connect? Check all that apply. And let's give this one a little under a minute as well. The options that we have here are data on CA Bridge Connect call text volume and connections to care across the state, stories and insights from people getting connected to care via CA Bridge Connect, tools and resources to better support connections to care based on your context or community, and updates on new opportunities to engage with California Bridge Connect, such as volunteering and events. I'll give this about another 10 seconds or so. Fill in your choices. Let us know what information you'd like to receive from us. Okay, let's go ahead and close out this poll. And so the results here, it seems like the top choice is tools and resources to better support connections to care. And close second and third, actually, data, stories, and updates seem to be really high up there on the list as well. Okay, thank you all so much for participating in that poll. Super helpful. We're so excited to bring more of this information to you in future webinars and also future communications with you all. Okay. I have one announcement before we close. Please save the date if you're in the Sacramento region. We will have an in-person regional collaborative. This is really an in-person event where regional leaders, anyone who's involved in substance use disorder care, it's really just to chat about how we can address barriers to treatment, how can we continue to expand access to MAT, let's share resources and build connections. Our information is still to be determined, like location, but check our regional collaboratives page for more information. But put this on your calendar if you're in that region to make sure that you have it saved. And that is it from us. Thank you so much. Let's stay connected. Let's help make same-day substance use care the norm in every county in California by staying in touch. All the different ways you can stay connected with us, what could be in the chat, as well as the recording and slides will be shared with you all after today's event. Thank you so much to Arianna for joining me, for co-hosting this event with me. Thank you so much, Reb and Katie, for sharing your anecdotes. Thank you so much for the work that you both do. Thank you, everyone in the chat, for the work that you do. Really, really excited to partner with you to expand access to care. And we'll go ahead and close out. Just last affiliation, again, we are funded by the Department of Healthcare Services, and we are a program of the Public Health Institute's Bridge Center. Okay, thank you so much, everyone, for joining. Thank you. I see all your thank yous. Thank you, everyone. Thank you.